Dr. Joe Congeni in our studio, Akron Children's Hospital, Sports Medicine Center. And Joe, I know you got some stuff, but it was nice to see Kevin Love back out on the court for us the other night.
Boy, it sure was.
18 points, getting back from the hand injury. Good stuff.
It was. And, you know, we spoke last week here, and I was super impressed by that interview. And I made that point clear that really was a good interview that touched a lot of people and opened a lot of people up, that opened the discussion, that has taken the stigma away and been tremendous. And so this morning, I don't know, maybe I'm getting to be a press conference guy, another press conference of a Cleveland star that really brought home some points that I think, some teaching points about our field of sports medicine, was Joe Thomas's press conferences this week.
Yeah.
The second one was hilarious. He just had a lot of very funny zingers in there. Did you hear his second press conference?
Oh, yeah.
Of course. But the first one was the telling one, I think, for sports medicine a little bit more, Ray. Anybody who comes in to see us in sports medicine, docs, trainers, therapists, our whole team, really the approach to kids, even from kids to high school to college to pros, there's really two parts to every evaluation. In the clinic, in the high school, when we're seeing people. Number one is kind of the full court press, get me better as quick as you can to get me back on the field. And we'll expose kids to all of what they benefit from, trainers, physical therapists, treatments to get them ready to play. But the second half of the equation is long-term. What are the long-term effects? What does this have anything that's going to be a problem down the road? And the big part about that makes our specialty different is prevention is really important, and keeping an eye on not burning any bridges for the future, not doing anything that's going to put these kids at risk long-term. A lot of people don't pay attention to that part and pay attention only to that full court press of getting the kid on the field. So we want them on the field as soon as we can, but we also want to see, are there some of these injuries that are going to have some carryover of problems? And in the younger kids, we talk about that. We talk a lot about prevention. As kids play on later into their career in high school, we have a lot of those discussions in our office and in the clinics at the high schools and colleges. When we go the next step is really when that decision is big. So I see a lot of high school juniors and seniors, and they're talking about wanting to play in college. And one of the things we talk about at that time is managing the injury or injuries they've had to try to minimize the issues they'll have for the rest of their life. So getting a chance to hear Joe Thomas talk about the fact, geez, it took 5 or 6 days of a week to try to get ready to play a game on Sunday. He needed full court treatment with a physical therapist and a trainer just to get those knees ready. 5 days of treatment to play on a Sunday, and that's how bad they were. He's got some issues down the road. He intimated he's got some surgeries, some replacement issues, and other things that are going to need to be done. He mentioned that for one interview, he stood for a minute and a half, and he was having so much back pain and knee pain just waiting to get to the podium to speak. So obviously, you pay more of a price the more you have some of these chronic injuries and want to play down the road. And I just want athletes to know the risk-benefit ratio of, if I'm going to continue to play on and I'm going to make a decision to play 4 or 5 more years in college, I may be burning some bridges for the rest of my life. And I want to make it clear to them what some of those things mean.
I remember a year, and we're going back probably 10 years ago now, when Joe Montana was in the area speaking with Suman. I had the opportunity to spend most of the day with him. And when I said to him, basically, what do you do now that you're retired? And he said, I can't do a whole lot because of the lingering effects of playing in the NFL. Kind of goes with what you're saying. He walked with a little bit of a limp.
That's right.
He was able to do a Stairmaster, could not run anymore, and could only walk on the beach, he said, at best. And that's that long-term effect. You can fix the knees,
right,
and get them ready to play for another year, maybe 2 years. But these long-term effects as you go down the road of life really start to pop up as you get older.
Yeah, and of course, you can imagine, you must know our dilemma is, as we talk to these kids, they're not thinking about when they're 25 or 35 or 45. But I strongly think it's part of our job in sports medicine to tell them that side of the equation too. So fortunately, a lot of things we deal with in the pediatric population, they're so resilient, they're going to bounce back nearly 100%. But unfortunately, there is a handful of 1 in 10 or 1 in 20 injuries that's going to have some longer term effects. Now, we ask kids, do you want to go through this another year? Do you want to lift all the weights and do all the conditioning and do what you have to do, knowing that you may end up with some issues with the back, for instance, disc issues and problems that could affect you as an adult? Or you're wearing out your ankle after several injuries and a fracture, and you're starting to get some signs of arthritis and other things, I just want you to be aware of. And a lot of times kids make the decision early on, I want to stick with it. As it gets a little further along, it's a tougher issue. And sometimes I'll send kids and families home about a college decision, and I say, come back in a couple of weeks, and I want you to ask me some more questions, and we'll talk about this some more. But there really is, if you play 5 more years in college, there really is more of an opportunity that you're going to carry some of this around with you the rest of your life.
And you and I have talked through the years about the concussion long-term effect and what that could be, and that's another story itself. I had one question pertaining to this.
Yeah.
As you sit down and talk to young athletes,
Yes.
and they get a concussion, is there a number or is it case by case as far as concussions, long-term effect on down the road? If Ray Horner gets 1 concussion, 2 concussion, 3 concussion, do we close the door on athletics? What is that talk like, and is it athlete to athlete, Joe?
Well, darn you, Ray. I mean, I had a very simple morning of a couple simple things I just wanted to talk about, and then you bring in the thing that's about the most complex we have always. And the reason it's complex, and I know you know this, is because we don't have all the answers. Mm-hmm. So if we're talking about a worn-out knee like Joe Thomas, probably torn cartilage, torn ligaments, he's got the structural issues in the knee are not there, and he's going to wear that out. And we know the pattern. We can really tell after years. The pattern in concussion is so hard to know. We're not sure. We can't say after 2 for one person, after 3 for another person. There are some indicators. I will tell you now, after 15 years of a lot of study, is there are indicators. If very minor trauma causes you to have a second concussion or a third concussion, that's not a good sign that this may not be headed towards some more long-term chronic. And I might be a lot stronger in that talk saying, I really don't think the risk-benefit ratio is worth it. And there will be tears in the office. Kids care and play a lot. There will be tears. There will be parents that are torn. You can see that they're torn on their faces. They've worked with, but it's the best we can. But part of it is just a projection by us. Whereas in other areas, we know the pattern well in ankles. We know the pattern in low back well. We're learning it still in concussion, and we're not sure. But to the best of our experience with 30 years of being in this field, we get a sense of some of these. And in concussion, a lot of it, we have to project ahead what we think. And there are times that, and hey, if you'd like another opinion or another thought, these talks are not easy. These are talks that we have in the office. This is the 2-part of the evaluation that I started my talk today to say about. Is short term, okay, we can do this, this, and this to get you on the field, but understand the long term of what ramifications it might have for the rest of your life.
Good stuff, Joe. Thanks for coming in. Great insight.